So we'll go ahead and get started. This presentation is going to be recorded, and if you have questions at the end, you're welcome to keep your video off if you're not comfortable with that. And we will probably cut some of the questions at the end from the recording that does get posted. So welcome everyone. My name is Brittany Wright. I'm the graduate coordinator, and I'll turn it over to our academic coordinator.
Hi, I'm Jeffrey Schoenberg, and I am the academic coordinator and a lecturer in the program also.
Okay. Quick details about the program. So our applications for the fall 2026 cohort are now open, and the deadline to apply is February 10th. Applying early does not increase your chances of admission. And we recommend students who are finishing up the fall quarter right now that you wait for those grades to post if possible. That way, when you submit your application, we have your most recent grades because we're going to ask for those. And we are a 1-year MA academic program, and our typical student profile is very diverse. So we have students interested in applying to PhD and med school programs, current undergrads looking to pursue careers in global health that may require a master's degree, and working professionals. So we've also had nurses, midwives, doctors who participate in the program to enhance their foundation in global health because they feel it's going to make them a better practitioner and help serve their population better. So passion is the one thing that we're looking for in our candidates who are applying for the program. And this is something that you can really convey to us in your personal statement. So this is an opportunity to show what draws you to global health and why are you a good fit for the program, and kind of share your story with us. We want to see that you have a real rooted connection to this field and aren't just doing it to check a box per se. So do you have any feedback on that, Dr. Schoenberg?
Yeah, I mean, I agree, and we do actually read those closely. And so when the applications come in, that is something that we absolutely notice because that's a way that we can sort of learn who you are outside of these sort of statistics. Your grades, things or that's on your CV. And so this is the way of understanding sort of your, again, as Brittany was saying, your personality and your sort of commitment to that. And I like the idea that she posts a slide that says passion, because it really is about passion. So
Absolutely. And I'd say that's one common core we see about students in our program is they really do have a passion to serve others, to enhance their knowledge and to do good in the world, right? So, give some context to your story so we can see what you have on your resume, but like give that background to us. And
mhm.
it really just gives you also an opportunity to explain things that maybe if there's something on your transcript that isn't a good reflection of you as a student, this would be a chance for you to kind of explain what was going on there too. So we do use a holistic approach when we're reviewing the application. So the GPA, your field experience, other factors are important, but we also are looking at the student as a whole and sort of what their background is. Okay. So in MA in Global Health, our program specifically focuses on social epidemiology, global health research methods, medical anthropology, global health policy and diplomacy, program management, and community health workers. So I'm not going to read through this slide, but this kind of gives you an overview of what our core courses are going to cover in the program. Which leads us to the question of what can you do with an MA? So it's increasingly recognized that health professionals with an interdisciplinary background and have a leg up on others who maybe are applying for jobs and for graduate programs and whatnot. So this program really gives you the opportunity to display these skills and to be effective in a cross-cultural setting. It also prepares you for jobs in non-governmental and governmental organizations, public and community health programs, global health research and policy, allied health professions and medicine, and it sets you up to apply for academic and doctoral training programs. So a handful of our students are going to med school or pursuing PhD programs. Do you have any other feedback on kind of what our students are doing with the degree?
Some students, are reaching out who are getting jobs, in clinical settings as coordinators. Students, I have a few students who, of course, were looking at jobs you wrote here, government organizations and in sort of local in local government, and of course in public health and local government, as well as a number of folks really do see this as a way of sort of a bridge between their undergraduate and going to get a PhD. I know in my experience, when I was going to get a PhD, there were very few of my colleagues who actually did go straight from undergraduate to get their PhD. And so a number of people went into the field, had research experience, but something like this, again, is another opportunity to sort of bridge that, to enhance your CV, to enhance your experience, and to really sort of show that you've sort of gone beyond that undergraduate experience. So
Yeah, exactly. And even for some entry level jobs, you'll see now that they want you to have 5 years of experience or
mhm.
advanced degrees, right? So this gives you a leg up against students who are coming in and applying with just an undergraduate degree or maybe just 1 year work experience. So this is showing you the extra level of commitment, and it's giving you skills to stand out amongst other applicants as well. Um, One question we get now is why is now a good time for a global health degree given kind of our world climate right now? So global health relevance is continuing to grow, and I'm sure we can all recognize that with the humanitarian crises, climate change, health policy, health equity. So we need passionate people in the field who are going to address these issues. Um, it's, understanding how politics, governance, health, it's critical in these times and how it impacts funding and kind of the whole cyclical effect of that. So this is good exposure, I would say, to seeing that in action. And so, resilience in time of budget cuts. So our economy goes through, cycles, and there always has and will be budget cuts and extra spending, so we kind of go through these phases, and right now is a time of budget cuts, and so it allows those in the field to get creative about how to make a budget stretch and how to find outside funding and partnerships, and it does spark levels of innovation, and we've seen a lot of advocacy and a lot of fundraising going on in some of the global health partners that we've seen. And
and no,
okay.
go on. I was going to say, and so many of the faculty in the program are in an amazingly diverse, it's an amazingly diverse faculty in so many different fields, and so the opportunities are to be able to to be exposed to different faculty in different fields, whether they're in medicine, whether they're in research, whether they're in academia. And this does obviously provide you with an opportunity to sort of expand what your interests happen to be. And I think that's a real strength of the program, is that it is so interdisciplinary in that way. And so I think this is a good time to be able to seek something and sort of be exposed to something that you might not have been exposed to or thought of before, and it sort of really kind of diversifies your opportunities for looking for employment.
Exactly. And it's giving you these skills that have the cross-cultural understanding and program management that prepares you to lead in these global or academia or public service jobs,
Mhm.
to allow you to be a tool for change. So here's just a quick look of a snapshot of some of where our alumni from the program have gone. And again, this is just a small snapshot. We have students who are program managers, project coordinators, research coordinators. Um, they've gone on to medical school and pursuing their MDs. And so we have a lot of students from a lot of different interests and backgrounds. which you can see through some of these job placements. And so now we've had some of our recent alumni now getting involved, working in refugee health and sexual health. So yeah, we're seeing an interesting array of opportunities. So our requirements to apply are that you need to include 2 writing samples. These don't need to be specifically from a global health course, but it is helpful. So if you do have samples from, anything that kind of shows that your ability to communicate global health, health-related topics, that would be ideal. However, if you don't have those, then, any writing sample would do. So that would just be an essay or, a case study or something from a previous class. Your resume or CV, your statement of purpose. Let someone in here. And again, as we said, you need to emphasize your passion in the statement of purpose and include your background, how this program fits with your goals. So we want to see that you don't need to have your whole life or career path planned out, but we do want to see that you do have some goal that fits within the global health program that we can help you to fulfill. So, a direction, I would say. And a transcript, 2 to 3 letters of recommendation. So one must be from a faculty member that you've worked with or taken a course with. And then the second letter must be from your supervisor who's observed you in a field experience or work environment. So we'll talk a little bit more about what the field experience requirement is and what that could look like for you. To be eligible for the program, you must have received a bachelor's degree by the beginning of the program. You don't have to have an undergraduate bachelor's degree. We have students from public health, biology, neurobiology, chemistry, ethnic studies, and whatnot. We do like to see, ideally, we'd like to see that you've taken some health-related classes or classes with a global emphasis. However, it's not completely critical. A minimum of a 3.3 GPA, and you need to have completed a global health field experience. And so when we talk about global health, we also include the US as part of the globe. So this doesn't mean you had to go internationally to complete this. This could be something done at a clinic in San Diego, working with a cross-cultural patients, and it's just getting exposure in that field. So it could be things that are volunteer or work experience, or for our global health undergraduate students, they complete a global health field experience requirement. So if you have more questions on that, we're happy to dissect that for you here shortly. And then you'll also needed to have completed a statistics course. So for the global health field experience, some examples are volunteering in a health clinic or a food bank or serving as a medical scribe, research position, studying abroad in a health-related context. And then if you still have more questions on what can kind of qualify, you're welcome to reach out, or our Global Health Field Experience page has great examples of what our students are currently doing for their field experience. Our application fee is $135 for US citizens and $155 for international applicants. There is a fee waiver for students who are eligible, so you apply for that when you're submitting your application. And you apply for our program. So if you are currently a senior and you're graduating this spring or summer, then you would apply for our fall 2026 cohort. So you have to have all of your bachelor degree requirements completed before the program begins. So if you have one course left to take in the summer, that would be fine. And we like to see for our global health majors, we want to see you've completed your core course requirements by spring. Our program, it is 1 year, it's fast paced, and so you're taking three classes each quarter, so 9 courses total. And upon completion, you're going to take a comprehensive exam and submit a professional development portfolio. Here's a little overview of our curriculum. So you have 6 core courses and 3 elective requirements. So typically what that would look like is you're taking 2 core courses each quarter and then an elective. So this is kind of a sample here. So you would take our seminar in global health research, for example, in fall and have an elective option. And then in the spring, your final portfolio is due and your comprehensive exam is during finals week. Also, there's a note here, students are not able to take additional courses outside the MA curriculum. We have that in there for several reasons. We want our students focused in on our program and not dedicating their time elsewhere, since it is just a quick 1-year program. And a lot of our students are employed as reader and TAs and have outside jobs. So we found in the past that students aren't able to fully focus and give their attention to their studies when they're spread so thin. So that is our program policy. So you would not be able to be taking other pre-med prerequisites during this MA program. Some sample electives are, we have this quarter, we have design thinking, or I'm sorry, innovation by design, tackling the sustainable development goals. And the electives will rotate each year depending on instructors' preferences and who's available to teach. So many of our electives are in-house through the Global Health Program, but students have also taken classes in anthropology, global policy, Scripps Institute of Oceanography. So being an interdisciplinary program, there's a little flexibility in that depending on what your area of interest is and if it aligns maybe with your research goals. We also have a program, the HFIT Health Frontiers in Tijuana, and so that's a quarterly internship and very popular with our students, especially in the pre-med track. So you participate in classes here on campus, and then you attend biweekly free clinic run with some of our UCSD faculty and students from the med school. And so that's in Tijuana. And you'll go and work at the clinic on the Saturday, and you'll help with vitals. You'll potentially develop research projects and get involved in the work that's being done there. So our program does have an independent research opportunity, which can count towards one of your MA electives. And this is a very popular route with our students. This would be something that you would enroll in during spring quarter, and you'll complete a 15-page research paper working with a faculty advisor and a research poster. We have an annual event called the Horizons of Global Health Research Symposium that our students present their work at. So you'll participate in that. And then for the independent research, this is something that you would seek out on your own. Our students come in with a lot of different interests and different backgrounds, and UCSD is we have experts in so many different areas, from mental health, refugee health. We've had students work with anesthesiologists and those in the maternal health and whatnot. So students can come in and we can help advise you and find a faculty mentor to work with. But this is something that you would seek out. And so your research that you'd be working on, unless you find a faculty member who has active research going on with an IRB and interviews and things that you could use, typically the students do more of a literature review. This here, Andreas, he was working with the HFIT clinic and he had access to data of the patient's BMI, so he was actually able to use that data for his research. So that's just a scenario. So it'll just kind of depend on what your area of interest is and what kind of active research is going on campus. And so a lot of our students will even work with faculty in the School of Medicine. In our program director, Dr. Chordash, he has a lot of work going on in refugee and mental health. And so we have some experts close to the program who've worked with a lot of our students. And this oftentimes can turn into a job opportunity or a research position. And we've had many of our students get into research positions for their independent study, and then they continue once they graduate to be involved with that to kind of bridge the gap while they're looking for their next career move and just getting more experience. So all of our classes for the most part are in person. Occasionally you'll have a hybrid class, so maybe the instructor will be half in person and half remote, but historically our classes are in person, so you would need to live full-time or be able to commute to San Diego up to 3 to 4 days per week. The class times can vary throughout the day, and that's based on the instructor preference. And typically a class is each class might be 3 hours a week or a twice a week session in the afternoon. And occasionally you'll have a class earlier in the day, but the reason we have most of our classes in the afternoon is because students will serve as TAs and readers. And so those are for undergraduate classes, and those are typically earlier in the day. We have a portfolio requirement, and this is designed for you to be developing your career portfolio throughout the academic year so that when you graduate from the program, you're ready to apply to jobs and have all the information in one concrete place. And so this entails an executive summary of your learning experience, a competency statement, professional statement and goals, your resume that you'll continue to update throughout the academic year, and some of your work samples. So this is something you can use when you go to a job interview, so that you have everything in one place. And so this is also just good for a reflection of things that, the main themes and competencies that you've obtained in this program. And the resumes, this program provides opportunities for you to boost your resume as well. So by contributing to being a reader or a TA, that would be work experience, volunteer opportunities. And then also, if you're presenting in research conferences, that's something that you want to add to your resume. So we really encourage that, since it is challenging if you graduate with a degree and don't have any work experience to show on your resume. I'm going to let Dr. Schoenberg discuss the comprehensive exam.
And so the comprehensive exam, as we see here, is a closed note half-day comprehensive exam that will consist of a selection of short answers and a selection of long essays. And here's a list of some of the various topics, but that's not that's not definitive by any means. Your various professors will write a couple of questions, and you'll spend half the day. And it's one of those things that I tell my students that as long as actually we had it open note. It wasn't closed note. It was open note.
Yeah, we changed that actually. Yeah.
It was open note, but not on computer. So you just had to bring your notes in with you. And as long as you had good notes and as long as you paid attention, it's one of those things that we just want to make sure that you come out understanding lots of the fundamentals that actually oftentimes cross amongst the various classes and sort of the kind of the more general ideals that students always get really nervous about it, and I tell them there's no need to. When they're done, they realize there was no need to.
Exactly. Okay, so some of the research and professional development opportunities that we've actually already kind of talked about. So you have the ability to participate in the Health Frontiers in Tijuana program, and that's something you can take for class credit. You can seek out faculty research positions through your independent study option. You can present in research conferences locally and nationally. And there's several professional development workshops throughout the academic year for you to attend. Sometimes these are within our division or program, or through career services, or through our graduate, it's called the Graduate GEPA, Professional Association. Here's a quick look at our cost of attendance. So students are eligible to apply for financial aid, which is in the form of loans. So here you can see the tuition each quarter is $4,380 each fall, winter, spring, so $13,000 annually. Then you've got all these other lovely fees, so it comes out to $7,000 and change per quarter. And then additionally, if you're not a resident of California, there's an additional $5,000 tuition each quarter, so it's 12 grand per quarter. So overall, as a California resident, you're looking at around $21,000, and as a non-resident, $36,000. And this includes your health insurance and access to the gym, certain other university fees. Many of our students, however, are employed as a reader or TA. So if you obtain a position of at least 25%, which is 10 hours per week, it covers all of those fees except for the non-resident tuition. So these California fees here, the $21,473.44 would be covered if you are employed as a TA or reader. In addition to that, you're also paid a pretty decent salary each quarter as well. So, so far we've been successful in having all of our students employed who want to be employed. There's no guarantee. This is something that you would be applying for. We have several positions in global health. However, not enough for all of our students. So we encourage students to apply in anthropology, ethnic studies, psychology, and biology. So that's just something that once you're in accepted into the program, you'd have access to the portal to begin applying for these positions. And it's something you apply throughout the summer. A lot of the departments don't hire until August or September before the academic year begins because they're still waiting to see what their enrollments are. And at UC San Diego, our transfer students don't enroll in classes until late August. So that's why we don't really have an idea of what our needs are. So it's something that it can be a little nerve-wracking if you're depending on it, but it usually ends up working out kind of last minute. It's just something you have to be patient with. We also have a lot of programmatic activities throughout the academic year for the global health community. And our main one is our quarterly conversations in global health. And so each quarter we pick a topic relevant to global health and we bring in faculty and community partners, researchers, experts in that topic who can come speak to us on a panel and have open discussion and we have a Q&A session. And so this quarter we're going to have ours on homelessness, and we'll have a panel assembled for that. And often we'll have opportunities at these events to get involved in those topics as well. So there will be some tabling organizations who will be there. And so if this is a cause close to your heart, then that would be a good opportunity to network at these events and talk to some of the global health faculty as well. And then we have our Horizons of Global Health Research Symposium in late May or early June. And this is kind of our capstone event for global health. So it's a display of all the research going on in our program. And we usually have a really great keynote speaker, kind of make it a celebration for the end of the year. So those are, so we have 2 quarterly conversations, and then we have our Horizons. So we have the 3 events, one each quarter, that you would be attending. We also have some resources on campus for graduate students. And so we have the Graduate Student Association. And so we have 2 representatives in our program who attend these meetings. The Graduate Student Association does things such as hosting networking events or career nights, or they'll bring in guest speakers, or they provide funding for conference travel or to host graduate events. So this is just one example of a resource we have on campus for our students. And that is the end of the presentation for our PowerPoint. So now we'll go ahead and open it up to discussion and answer any questions you might have. So feel free if you want to you could raise your hand and we can call on you, or feel free to write it in the chat too, if you're more comfortable with that.
Hello. Um, Hi. I'm currently a student in the Global Health BS program,
Mhm.
and I'm planning to apply. Currently a senior. I was just wondering, what are some advantages coming from the program to apply, and how could it prepare me as pre-med looking into MD PhD?
Yeah, so Jeff, do you want to answer that since you have some good experience working with our undergraduates?
I think, you may actually experience some of the same professors. And of course, if you have, the recommendations, and there are professors in the program that could obviously recommend you, then obviously then we have a relationship with those with those people. Um, and in terms of going on to an MD PhD, I have a PhD in medical anthropology, and I worked with a lot of, went to school with a bunch of folks who did various MD PhD programs. And I think what the program really allows you, first of all, there's such a strong emphasis on the social determinants of health in our program. And I know a lot of the MD PhD programs probably, are do work along those lines. And it also allows you to, engage, and this is in the spring, some sort of research project. And I think that's very beneficial, that you have that research experience if you're going for something like an MD PhD. So I think, being part of the program, in and of itself, like I said, you're already familiar probably with some of the folks who are involved. And so I think that could be helpful.
Definitely. And I think you'll come in with a very strong foundation that will make you successful in the program and maybe have a little bit of an advantage because of that in terms of how far you can take that, just how far you can get into your research, and you have you understand the network at UCSD, which can be pretty complex. It's a large university, and so I've been on campus for like, oh my gosh, I'm an alumni, so like, I don't know, 20 years or something like that. And I'm still like trying to figure out certain aspects, and things are always changing. So we're sort of here as like your tour guide and of campus for those who are not familiar, or even if you are, because there's always so much to learn. And there's so many different entities doing research and things like that, we're just a resource for you to kind of point you in directions.
Mhm.
And so I think that's definitely an advantage. And then the other advantage is you really knowing that this is a good fit for you because you've experienced what the global health curriculum is like, and this is taking a deeper dive into that. And so you have a very clear expectation of what you're going to get out of this program. And so we're not an MPH program, it is a Master of Arts. And so that can provide you the same career outcomes as an MPH. It's just a different vehicle to get to a career destination. And so I think that's something that's also nice, is just to have that very clear expectation. And so let's see. Does that answer your question enough?
Yes, thank you.
Okay, so we have a question from Carolyn, and she wants to know, so we have the HFIT program. Are there any other built-in internship opportunities? Not at the time. However, if you come across an opportunity you want to get involved with, we're very open to, we have a lot of flexibility in the program because our students are from so many different backgrounds and have so many different interests and career goals. So we're very supportive of students seeking out opportunities to get involved with. And so sometimes you'll learn about those from guest speakers in your class or through class, events that you attend on campus, networking events, or by talking to your professors and learning more about things that they may know. So if you're proactive and you have kind of something that you're interested in pursuing, there's a good chance there's going to be something on campus that you can get involved with. And so how competitive is it to get into the program? Also, when would you guess we would hear if we got in? So usually you'll hear, if you're kind of like in our first draft of admits, you'll hear by the end of February. And then what we usually do is say we want to allow 15 students into the program. We'll allow our first batch of 15 and sort of see who accepts or declines, and then we'll continue offering positions out over the next 2 months. So, ideally by early March, you would have an answer from us. But if you don't hear by then feel free to reach out to me at the MA Global Health email, and I can kind of give you an update on where things stand. And and then how competitive is the program? That really depends on the application pool that we get. So if we have a large application pool and it's a bunch of students with the 4.0 with, the perfect global health background. However, we do like our cohorts to be diverse. And so if you kind of meet our criteria and have, that passion card and kind of show some direction and we really feel that you're a good fit, I would say it's pretty decent chances of being accepted into this program. So it is a very niche program. And so, you know, it attracts a good, interesting pool of applicants. And usually our applicants are very qualified applicants. So if you're reaching those criteria, then I would say it's, you know, you stand a decent chance.
Mhm.
Okay, so I work in the healthcare industry as a technologist. Very cool. Currently doing my gap year before grad school. Would it count as a global health field experience? What is a technologist? Do you know, Jeff?
I don't in this
Sorry,
case.
I can
Okay.
explain. Yeah, so I work as a neurotechnologist. So pretty much what I do is I work under a neurologist, recording EEGs for patients with neurological diseases and conditions. So I do have like a direct patient care experience, and I'm sort of in the pre-med track as well. But I wanted to do, I went to CSD. I just graduated, and I was very interested by the program last year. So yeah.
Okay, yeah. So in that scenario, yes, that would definitely qualify. You're working in the healthcare industry, and that would we want to see that you've kind of understand the field a little bit so that you know that this is something that you want to get into, right? So that's always the point of like these experiences or internships. It's like you need to make sure that this is really a direction you want to go so that you're not wasting your time, our time. Like we want committed people in the program. So if you can kind of make that connection in your statement of like how this path is leading you to your next steps, right? Then that would definitely be a fit for us.
Thank
So
you.
yeah, that's great.
Any other questions?
I had a question. If we are fourth years finishing, are there things that we can do to strengthen our application, like taking certain classes in the winter or spring upcoming quarters?
Are you a global health student right now?
I'm sociocultural anthropology and gender studies.
Okay, cool. Have you taken any global health courses?
I have taken medical anthropology and psychological anthropology, and I just completed the McNair program, doing research on gender and sexual identity formation.
Okay. So we've had a lot of that synergy interest for students in our program previously. So I definitely can see that is a good fit. And then I would just recommend if you can take any electives in the global health program, that's going to help you get more exposure and just show that you're committed to the field and just give you a little more foundation for entering the program. But to me, it sounds like you're in really good shape right now. So you know, do what works for your schedule.
Great, thank you.
Yeah.
Other questions?
Hi, I had another question regarding the letters of recommendation. I've had instances where I'm kind of confused on the academic or professional, where you have internships or fellowships with a professor, versus like work experience or actual lectures. Where, how would you recommend going about getting those letters or being strategic about that?
Yeah. So are you saying that like do you want to tell me a little bit about what your experience is or so I can kind of connect it?
Sure. I've had quite a few internships on campus, as well as like a research fellowship. Um and there's times where I'm just not sure what qualifies as what.